Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Abbie Goodman and Dr. Natalie Meyerhofer, the fun 2-woman team at Inspire Family Chiropractic in Appleton, Wisconsin. Before we jump into today's episode, we wanted to share a little bit about each of them. Dr. Abbie grew up in Appleton, attended UW-Eau Claire for her undergraduate degree, and then went on to complete her schooling at Northwestern Health Sciences for chiropractic. In 2017, she ventured into business ownership and opened the doors to Inspire Family Chiropractic. While she loves providing chiropractic care for the entire family, she has focused trainings, certifications, and passions for the prenatal and pediatric populations. Dr. Abbie loves spending time in the yellow sunshine, enjoying yummy food and coffee, camping, hiking, traveling, and spending time with her husband and 2 young kids. Dr. Natalie grew up in Iola, Wisconsin, and now lives in Kaukauna with her husband and 1-year-old son. Because her mom was a chiropractor, Natalie was blessed to be able to witness the miracles of chiropractic from a young age. Dr. Natalie attended UW-La Crosse for her undergraduate degree before heading to Minnesota to finish chiropractic school, and during her schooling, she discovered a passion for prenatal, pediatric, and family wellness chiropractic. In 2021, Natalie lost her mom to ALS, and now she has found the best way to remember and honor her is to provide the same care and dedication that she showed her patients every day. These 2 ladies are a breath of fresh air and literally radiate sunshine themselves, which is why we know you're not only going to find these 4 episodes with Abbie and Natalie educational, but also incredibly fun to listen to. It's time to turn up your volume and let's get started with today's conversation. Hello, everybody. Welcome back. We're here with episode 3 with Dr. Natalie and Dr. Abbie. Welcome back, ladies.
Thank you.
This is so fun. We just love having you on here and giggling with you the whole time. It's so great. In episode 1, if you guys did not listen to that one yet, we talked a lot about Abbie and Natalie's stories as well as their primary population. So they specialize in pediatrics, the pregnancy population, postpartum, and then of course families, because they're always going to bring the rest of their family with, which is amazing. But also then in episode 2, we talked more so about how does chiropractic actually work? How does it affect the nervous system? How does it help to kind of flush stress and toxins? How does it help in so many ways? So if you've not listened to those yet, those would be really good baseline information as we head into this episode, which is going to be more so focused on revealing some of the unexpected benefits that you may not even know about through the different seasons of life. So we're talking about trying to conceive, pregnancy, postpartum, but then for the littles, those little bodies are so different with teeny tiny newborns to toddlers who are very wiggly up to school-aged kids. So I think my first question for you is that you guys have a specialty here, which is amazing, but they're almost they're very different bodies. A pregnant woman probably has a little bit different approach maybe than a woman who is not currently pregnant, and a woman would have a very different approach than a tiny infant. So can you start by telling us, do you kind of approach each of your patients in a similar way, or do you have to take a very different approach based on their age and their stage?
It's a great question. I would say we definitely take a different approach, and I would break it down even more to the individual, right? Every individual person coming into us likes a different kind of touch, a different kind of pressure. We have learned throughout schooling and past schooling with our continuing education, different kinds of adjustments we can do. So essentially, the adjustment is doing the same thing for everyone, but everything we're doing with the person is different. So if we want to start with babies, the pressure there is very light it looks like a whole lot of nothing.
It does.
I've been telling my parents that recently. I'm like, it looks like I'm doing nothing. I promise I'm doing a lot. But usually the best way to describe that is like if you go to the grocery store and you are looking at your avocados and you're like, ooh, I want to check the ripeness of it, right? You give it like a little bit of a squeeze, a little bit of pressure. That's essentially how we're adjusting babies, is we're feeling that spine, or feeling how all of the different joints are moving and everything. And we're just putting like little bits of pressure as we're kind of checking everything. So when you think of your typical chiropractic adjustment, that's where we have a lot of like fear based around like our infant adjustments is like, oh my gosh, are you going to adjust them like you adjust me? It's like, no, we're not at all.
Right.
And so explaining that to parents is like, nope, this will look very different. It'll be different than anything you've ever seen, but we're still doing the same thing.
Yeah. We truly obviously every baby's different, but a lot of babies actually just sleep right through their adjustment. If they come right out of their car seat, they go right on our little pillow. They just keep on sleeping.
Yep.
So it's very, very light pressure. And then as they keep getting bigger, we get to the wiggly toddler stage where you'll see Dr. Natalie and I running around the office chasing them and adjusting on the go, because if they're on the go, we're on the go. So we have a kids play area that a lot of the kids will just kind of choose to not want to go in our rooms because, either they want to be playing or sometimes they have a fear of going into the doctor's room. So we'll just go kneel right behind them and adjust away. We still can use some gentle types of approach like we did when they were infants, but then as they're getting a little bit bigger, we can use a little more pressure. Sometimes if they're really on the go, we also can use a tool that's called an activator. That is an instrument that just makes a little click sound. The kids call it the clicker. And we can kind of adjust them a little bit easier on the go with that tool.
Mm-hmm.
So for adults, how does it look different from when a woman is like trying to conceive versus is actually pregnant and has the belly on her? How does the style of adjustment maybe change?
Yeah. Well, when they're actually prenatal, when they're true pregnant, we use a technique called Webster technique. We can actually use that also when they're in preconception and in the postpartum stage, but it's truly the only technique that we should be using on our pregnant moms. There's a lot of research behind it, and we're both certified in that specific technique. But that one, what's cool with that technique is they can actually still lay on their stomach, which a lot of times, especially later on in pregnancy, moms are coming in like, can I just lay here?
I'd be like, I just want to lay here. Yeah.
Yes.
Yeah.
So we have these cool pillows that they kind of just plump their nice, cute little belly right on in the pillow. And then it's nice and cozy, and we can adjust away using that specific technique. We use pressures. We can use our table that can go up and down. It's called the drop table to help mobilize those joints the way they need to. Where when you don't have a belly, we're not needing a pillow. So even though we might be using the same technique, the table and the pillows can kind of help mold the patient to where we need them to be.
Awesome. I feel like that is just helpful to kind of be able to picture what this would look like, especially if someone has kids and they've never brought them to a chiropractor, and how it doesn't have to be scary or intimidating. I love how you'll just kneel next to a toddler as they're playing with blocks and you're like, I'm going to take care of you and your wellness, and you don't even know it.
Yes.
That's pretty cool.
I really like that too, because they can feel comfortable going to you.
Absolutely. And it's really cool for us to get to watch too, because if you see a chiropractor, typically you're seeing them way more than you are seeing like a PCP or, other practitioners. So we really get to know these kids and their families and to watch the transition of the kids that are maybe shy in the beginning, or we have to adjust in the toys, and then all of a sudden they're bolting through our door and they just slide right on the table because they're ready. So it's cool to get to watch that transition too.
That is really fun. And I think a lot of people, when they think about chiropractic, they think, about the popping of joints, making sure you're in alignment, which is why I loved episode 2, where we really zoned in on the neurological side of things and how important that piece is. But there's also a lot of like unexpected benefits that you can help with throughout these different seasons of life. So I think that would be really fun to just kind of run through different seasons, different type of people and population that come into your office, and what are some of the unexpected benefits that chiropractic can actually help with. So maybe starting out with like preconception or even fertility. Can you help with that when people are trying to conceive?
Mm-hmm. So back in episode 2, where we were talking all about that brain to body connection, right? That's a lot of what we're doing with like preconception and fertility work. Is every part of your spinal cord is kind of talking to different organs, right? And so if you think about your reproductive organs, your brain has to talk to them and they have to talk back up to your brain via like hormonal regulation, having your periods, right? Having cycles, having normal cycles, ovulating, all of those things. So when we're actually adjusting, if we adjust certain areas of the spine that are talking to that area, that's what we're trying to do, is kind of clear up that communication. So if that's, part of the issue, or someone's dealing with infertility or something like that's going on, it's not everything. I don't think we will never claim to be like, oh, we can, heal your infertility.
Correct.
Never, ever would we ever claim that. But is it probably a piece of the puzzle? Absolutely. Is getting that body and that brain back in communication.
Is an aligned neurological system, does that have anything to do with like how our hormones are working?
Yeah. Yeah. The brain chemistry is so complex, and it's really cool because as we keep diving more and more, even through continuing education, we just continue to get to learn more and more about how complex this brain of ours really is. And it all comes back to the full function of our full system, because the brain triggers one thing to release, and that release goes to this organ, and this organ releases it here. And it's such a cool pathway. But if there's any kind of blockage or any kind of disruption in that system of flow of that hormone exchange, that's the nervous system kind of saying, hey, something's going on. And that's totally where chiropractic can really help open that up so that the hormones can regulate appropriately and get the jobs done that they need to do. Yeah. And to the point too of, in that for infertility or just fertility journey, a lot of parents, moms or future moms and dads, can get super stressed.
Oh yeah.
And we talked about stress a lot in our last podcast, but during that phase of life, it is all that you think about. And just bringing both mom and dad, man and woman, in to bring the adjustment, it can truly help with adapting to that stress to help ease the system again with that hormone regulation.
Yeah, that's such a good point.
Would chiropractic help the man too, fertility wise as well? I would think.
Yep. Yeah. It's not as complex.
Right.
Our men are awesome, and they're just not as complex. But typically, it can come down to stress too, because they absolutely have hormones that are going to help bring that side of the reproductive system. So it can for sure help with regulating that too.
What about once a woman is pregnant? What are some of the benefits of chiropractic?
So I think just comfortability in general. That's like the main
big one.
Yeah. The main reason is like, lower back, right? Or even like those round ligaments in the front, or pubic bone, everything around the pelvis. I feel like most of our pregnant
so much. Yeah.
Yes. And you have, our lovely hormones, relaxin is making everything a little more like loosey-goosey too. So yeah, just the big changes with that for comfortability. But we have all these fun little posters hanging up in our office. So we have like each stage, how we're kind of talking about each stage. And a lot of our pregnancy poster talks about just like, right, a more comfortable pregnancy. And even getting adjusted throughout your pregnancy can lead to an easier labor or a shorter labor, a more comfortable birth, kind of all of those things. And once again, going back to stress, like I feel like this is the main talking point of our entire morning, but seriously, like getting the stress out of that body and helping it to adapt and just do what it needs to do just makes everything flow how it should.
It does. Especially with our pregnant moms, when stress is in the body, we all can feel it within our muscle system, right? But when we're developing a baby in utero, those muscles that surround our uterus can also play a big factor into sometimes why babies like to go breech. So moms that haven't been seeing us through the chiropractic journey, a lot of the times we'll get them to enter our office kind of in that late third trimester phase when they're like, oh my gosh, baby is breech. Someone told me maybe a chiropractor can spin this baby. And we're not spinning the baby, but we're making its home bigger because we're taking that ease into the body, taking the stress out of the body of those muscles that surround that uterus and opening up their home so that baby will want to flip and be head down. So
which is why it's important to think about getting to a chiropractor earlier in your pregnancy so you have all that room for baby and you're not coming in at the 11th hour going, right.
Yeah. And I would assume through that, you're also helping to set them up for a better labor.
Yes. Yeah. Yeah.
So
because if baby's happy in there, if they're happy and head down, It's going to stimulate the correct hormone release when we need to. Again, hormone regulation during that whole birthing process and getting the body to do what it's made to do. We're miraculous. We're supposed to do these things with ease. And of course, the birth and journey is a journey in itself. But if baby's doing what they're supposed to be doing head down, the ease of our body's nervous system is in full flow, that labor can really decrease in time and in all the symptomatology that can come with it, decrease that.
You're just setting yourself up for success.
Yeah.
Right?
Yeah. That's why we love our pregnant moms to come in, because when mom is comfortable, baby is comfortable,
Yes.
right? But it starts with you. And I think during pregnancy and even motherhood, we think of our kids first, right? You're always just like, oh, but I want to make sure like the baby's doing good, which of course, but it's like, no, we got to focus on you first. Like if we can get it all correct with you, everything else will just fall into place. Yeah.
Well, and then I think about with postpartum, oftentimes women are hunched over, changing diapers, breastfeeding, bottle feeding, whatever it is. You're just exhausted. So you're just to
stress.
Are you sleeping? Yeah.
Right, exactly. So is that something you help with? And are there any other benefits for the postpartum period?
Yeah. Think about how much our bodies are physically changing during that period of birth to, year out postpartum. I mean, there's so much change going on, and adaptability is such a big word in chiropractic because it's our body being able to just come together, figure out the new and adjust accordingly. So yeah, absolutely. The body physical changes that go on in postpartum can be very much helped with chiropractic care.
Absolutely. Yeah. And just to go off of that a little bit, straying away from chiropractic just a bit, feel like a lot of our postpartum moms come in and they just need a listening ear too.
Oh,
you know what I mean? And they're seeing us, maybe they're seeing us a little bit more, like you said, more than their primary care, or more than, right, that 6-week visit where you get cleared and all of that, is they can talk about the things that they're dealing with, or the things that like, wow, I didn't know this would be that hard. Like I didn't know that this happened postpartum, or I didn't know that that happened postpartum. Or like this happened during my birth. Like, why didn't anyone tell me this?
Yeah.
We're like, hey, like we've all been through it in one way or another. And that in and of itself, I feel like is a stress relief too.
Yeah.
Oh, absolutely.
For sure.
Oh man.
That is such a good point. And I feel like you just become like part of their wellness team from that alone, So that's amazing. Okay, so mom has baby. Baby is a teeny tiny infant. I've heard there are a ton of benefits for those littles. Colic, constipation, things like so chiropractors can help with some of those physical things.
Yeah, really, if you think about, all the way through the years, if your nervous system is giving signs and symptoms, so that for those babies, like you just mentioned, all of those, ear infections, reflux, not sleeping well, all of those are just their nervous system saying, hey, I need help. And what's cool with our office is, again, that nervous system that we talked about in podcast 2, we can help because we can figure out where that stress truly is in their body and just release it. And then these babies are great and they can just flourish and thrive and have well.
And that includes latching too, because feeding and breastfeeding is,
absolutely.
That's a whole nother topic in itself.
Right.
But I know a lot of moms have trouble or can have trouble with the latching process. And so I know like you guys could probably help with that too.
True. Yeah.
Yeah. We do a lot of work too. Just another like technique that we use is, well, I don't really know if it's a technique, but we will check the mouth, right? So if we're talking about latching with babies, is you have basically like you need your tongue to work and you need your jaw to work and you need that whole mouth to work to be able to basically take milk off a breast, out of a bottle, however you're feeding your baby. But we have these little finger cots that we put right on our finger, and we can assess the upper palate. So that hard palate, like the hard top part of your mouth, plays a huge role. We can do muscle work on the jaw. We can work with the tongue, see how all of that's moving too. So that's another huge part of the adjustment.
Absolutely.
That we can always check out with baby too.
Yep. And we're both trained also in cranial sacral work, which if we're finding things inside the mouth, typically it's also happening in the cranium itself. So working hand in hand with inside and outside.
Yeah, that's huge. That's awesome.
And then as they continue to grow, so like Dre and I, we have school-age kids. What can you help with in that age? Because this is becoming a little bit closer to how you would probably treat adults. They're super active and they're crashing all the time.
Adults
and they're
don't
jumping
jump
off
from
really
trees
inappropriate
and
things.
roll around in the grass and whatever else they do.
So how can you assist these crazy kids when they are making bad choices on a daily basis?
Yeah, we see this a little bit in the office too. But basically, again, like they might be crazy with their body, but their bodies are also miraculous. So it's just releasing that stress that we keep talking about, and it's cool because each person is so unique. So those kids that are climbing on trees and falling down, well, right, they've got some physical injuries going on. So we're going to help get the body get regulating and get going in that healing process and take away some of that discomfort that might be showing up in their physical sense. But it does come back to just that nervous system helping regulate and bring ease to the system itself. A lot of times those ages kids, even if they're not throwing themselves off, you know what, they're also just can be complaining of like growing pains as a big one. And it's a true thing for their system that it's just their body's adapting and not truly knowing what to do with the physical changes that are happening, and chiropractic can help a lot with that.
What about like mental concentration? Like ADHD, concentration in school.
Yeah. Mm-hmm.
Okay,
Yeah,
so that's all just related. Okay.
Yep. So when we were talking back in our previous episode more about like that sympathetic nervous system where everything is kind of just like go, 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 foot's on the gas pedal, that's where we see a lot of more of our like ADD or like we're overstimulated, right? Mm-hmm. Kids are overstimulated. They're not able to express their emotions correctly. That's where chiropractic adjustments come in, and to specific areas of the spine, we can help kind of decrease those symptoms and get that more of that parasympathetic and just that rest and growth and healing happening versus being overstimulated all the time. Bedwetting's another huge one, I feel like, at this age, right? Because it's always questionable as the child gets older. You're like, oh, but you're still bedwetting. And that's another huge nervous system thing that's going on that, like, for some reason, whatever that brain is trying to tell that body is not in communication correctly. And so that's another huge thing that we help with too.
Yep. And a lot of times with bedwetting comes sleeping regulation too for kiddos. And as they get older, now we're talking kind of high schoolers too, how we see these kids needing more sleep. And it's true that physically, chemically, their system does need more hours in their night. But the true quality of what they're getting and chiropractic can get you into that rest, digest, heal phase in that parasympathetic system to really help these kids get true quality sleep so that their system can rest and recoup for the next day.
I would assume a family that maybe has a child who is struggling with anxiety or depression, like you would highly recommend them having regular chiropractic visits.
Yeah. Yeah. And regular is a great way to say it because every person is very different with how regular they should be coming in to help regulate their body. But absolutely the help that when your nervous system is in full force, that it can play into that mental awareness, how we're adapting to emotions, all of that behavioral. It's a big piece that our society really truly is missing. When we're talking mental health, it can come down to regulating our nervous system.
And before we close out this episode, I do want to just touch on adults. Are there any kind of unknown benefits that adults can have and experience because of chiropractic?
Yeah. I mean, you hear the typical ones like, sciatica, joint pain, but
right.
Headaches is a huge one because migraine, headache, I mean, they can take over your whole world. So that's a big one in our adult community.
Sleep is another one, I think. And, there's so many factors that play into it too. But I think a lot of our adults are constantly talking about like sleep and digestion, right? Is like you just have a lot of these like things that should be normal and that your body should be doing throughout the day. And I think adults really benefit.
Yeah. One with immune system too. We haven't touched on it all.
Oh my gosh.
Right. We see
'tis the season too for immune system care.
Yes. Yeah. And a lot of, this is from infant up, but a lot of our adults realize like how much their body's able to adapt to their sickness with chiropractic care, more of our wellness patients. So if they're feeling the onset of a cold or an onset of the flu or, like any of those signs of allergies types start to creep in, they are in our office right away.
We tell them to come in.
Yes.
If you are sick, please come and see us.
Yeah, because we know for our own bodies, it just helps bring down that time and it makes your body quicker into that immune response and can really help adapt to dealing with that sickness. Mm-hmm.
Oh, that's a really good point for all ages. Like my daughter was talking about having a little bit of a sore throat recently, and I'm like, I should probably get her into the chiropractor.
Yeah.
Like, we should all go, get it out of my house.
Yeah.
Yeah. No, this is so awesome. I mean, obviously, like you were talking about in episode 2, how chiropractic works and like their neurological function, it's simple when you're able to explain it, right? But like the ricochet of the amount of benefits is just incredible in so many different ways. So why not? It's such an easy thing to add into your wellness routine. And you guys are just, you're just so awesome, such easy people to talk to. So I think if anybody has questions, they're listening to this and they're like, maybe they've never experienced chiropractic or they just moved here and they don't have one established yet. And they just want to ask you a couple questions about your practice. And if you're a good fit for them, how would they get in contact with you?
Yeah, they can always find us on our socials, going to our website and giving our office a call. We're always willing to do a phone consult too. If you have questions like, do you really think I'd be right for your clinic? Please just give us a call. We're happy to point you in the right direction. But yeah, you can find us on our website or over the phone.
Or even if they have questions like, my son or daughter is experiencing this, is this something chiropractic could help with that we didn't touch on, in this episode? They can just call you and ask those simple questions.
Absolutely.
Awesome.
Yep, we're here to help.
Yeah. No, this list is just incredible. It's just so impressive on everything that chiropractic can help with. In our next episode and our last episode together, we're going to be diving a little bit deeper into pregnant mamas and postpartum mamas because that is a very challenging season of life, both physically and mentally and emotionally. So we're going to dive into that in our next episode. But I did want to just mention really quick that these ladies are offering a discounted neurological scan for our listeners. Normally $175, dropped down to $95 with the mention of this podcast. So Abbie already mentioned how you can get in contact with them. If you're not familiar with what their neurological scan is, go back and listen to episode 2. But that is an amazing offering. And thank you so much for offering that to our listeners.
Yeah, absolutely.
All right. Well, we'll be back in our last episode together. So stay tuned for that. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.